This study looks at the relationship between television viewership and women's status in India. So we initially got interested in this because there's been a dramatic growth in access to television, satellite television, cable television in particular, throughout the developed world, including in particular in India, and sort of understanding how that's going to affect a variety of outcomes is important, but in particular, one thing people wonder about is what kind of effects might there be on demographic outcomes like the status of women, like education, like fertility. And when you look at anthropology, anthropologists have thought about this question, and in fact, people seem to respond very strongly to television. They say, television has changed my views about topic X dramatically. There's actually some really interesting stuff about what happens when you bring TV into the Amazon, which is just completely, people know nothing, and all of a sudden, people all of a sudden understand that the U.S. is, not a place where everybody plays basketball and so on. So it's a lot of really interesting stuff about this in the anthropology literature, and I think we wanted to look at these issues using a more kind of quantitative approach. It's typically how economists would often think about addressing this. And so basically what we're doing in the study is very simple. We're trying to understand, looking at the data in India, in rural villages, what are the effects on the status of women when you introduce cable television in particular. So we're looking at the effects of television on a variety of measures of women's status. We ask about son preference. So would you like your next child to be a son? This is something people worry about a lot in India and China because gender ratios are very skewed. We ask women a series of questions about whether they're allowed to make decisions on their own. So we typically just refer to this as autonomy. It's questions like, are you allowed to go out of the house without telling your husband? Are you allowed to make decisions about your own health care? What I think is actually often kind of striking for people in the West is many of the answers to those questions are no. So, for example, in the sample that we're looking at, when women are asked, do you make decisions about your own health care? I think about half of them say that they make those decisions on their own. About a quarter of them say that they make that decision in cooperation with their spouse, and about a quarter of them say that somebody else, like their spouse or their parent-in-law, makes the decision. If you think about that, it's actually, for me, that was a very striking number that said basically, I don't feel well, and I have to ask my husband or my mother-in-law whether I'm allowed to go to the doctor. So I think these are a set of things which many of us think maybe it would be nice to change. And we also ask about attitudes towards beating and about fertility. So those are also things which are typically linked to women's status. What we do in the study is we look at data that varies over time. So we have 2,500 women in 180 villages, and we interview them in 3 years in a row. So we see them in 2001, again in 2002, again in 2003, and we ask them the same questions, all these questions about women's status. Can you go out without telling your husband? Can you keep your own money? Is it acceptable for a husband to beat his wife if she does thing X? We ask them all these same questions 3 years in a row. Now, fortunately for us, during the study, some of the villages get access to cable. So when we arrive in the study, I think 65 of the villages have cable in 2001. We come back in 2002, it's 75 villages. We come back again in 2003, it's 86 villages. So there are basically 21 total villages of this 180 who add cable sometime during the sample. And the methodology in the paper, the way that we try to figure out whether cable affects attitudes, is we just look at whether there are changes in attitudes in the villages that get cable relative to the villages that don't get cable, and whether those changes line up in terms of timing with the timing of cable introduction. So, for example, we could look at whether attitudes towards beating improve in the villages that get cable between 2001 and 2002, improve more in those villages than villages that didn't get cable, and whether that improvement happens between 2001 and 2002 relative to improvements that might happen in villages that get it between 2002 and 2003. Do those villages see the improvements in that period? So that's the identification strategy. That's how we're going to try to figure this out. In fact, what we find in the data is that there are really quite large effects on the status of women as a result of this introduction of cable. So we see that, again, the timing lines up correctly, and when you get access to cable, women see improvements in their autonomy. They're more likely to say they're engaged in decision-making in the household. We see decreases in the acceptability of beatings. They're quite a bit less likely to say, it's okay for a husband to beat his wife in situation X. We see decreases in son preference. Women are less likely to say they want their next child to be a son. We see some actually quite large falls in fertility. So the rate of pregnancy goes down. And in fact, in looking at some sort of separate data, we see some suggestive evidence that education for children seems to improve, that school enrollment goes up. So these effects seem to be large, and by large I mean that we can think about how much they move these rural villages toward looking like urban areas. So we look across India, urban areas tend to be much more liberal and so on than rural areas, and we can ask sort of if you start in a rural area without TV and then you get TV, how far does that move you towards the urban area in terms of your attitudes? And the answer is actually somewhere between 50 and 70% of the way. So it moves people pretty far towards looking like these urban areas when they get access to cable. What's interesting for us in thinking about the content is you might have expected, for example, that this had good effects because what people are watching on TV are informational shows about how you should be nice to your daughters, or shows about liberated women and how it's really important that women have jobs and are able to make decisions on their own. In fact, what people like is soap operas. So I think we have a good sense of what these shows are, and I think that knowing that that's the kind of TV actually gave us some pause in thinking about, could this really be something that's affecting people's attitudes? But I think what's important to remember is that the sample that we're looking at, the sample of people whose attitudes we're claiming changed as a result of this, are people who live in pretty isolated rural areas. And the people who are on TV live in urban areas. So TV depicts rich, successful, urban people. And relative to the kind of, it may not be that they're depicting super liberated women who say that I don't need men, and this is not Murphy Brown. On the other hand, these women typically do have jobs. They make decisions in the family on their own. There's no beating because it's not even allowed to be shown on TV. So relative to the kind of behaviors and attitudes we see in these rural areas, TV is going to be very much more like urban areas. Just the behaviors are going to be much more favorable towards women, if you will. And so we have this notion that despite the fact that the TV shows are not particularly geared towards kind of giving people information or telling them that it's important to take care of your daughters, in fact, seeing these peer group on TV, which is behaving in this more kind of liberal, positive towards women way, that's what's moving people. A lot of times, there's a lot of emphasis on this problem of the low status of women in India and China and these developing world. Is something that I've done other work on. I think it's obviously an important issue, and there's a lot of specific policies that governments or other people have done to try to address this. So, for example, there are a number of programs in India where they pay people to have daughters. So, effectively, if you show up at the clinic and you have a girl, you get money. And so all of these are kind of along the lines of trying to discourage sex-selective abortion, to encourage people to value their daughters, and there's people try to subsidize female employment for some of the same reasons, to try to make women more valuable, and so on. So there's a lot of programs like that, and they typically haven't been that successful to the extent that we can evaluate. It just doesn't seem like people are that responsive to this type of incentive. So I think what's sort of interesting about what we find is this, of course, isn't a government program. This is just some guy wants to make money. He brings a satellite dish into your village. You hook up the cable to it. You pay him. You watch the TV. This is going to happen with or without government intervention. People love TV. So one of the enduring facts about TV research is people just cannot get enough of TV. All people love it. They think it's the greatest. So it's not something that, in some sense, it's kind of the opposite of a policy implication. I think this really does give us some clues about what we might expect to see as places continue to globalize broadly. So I said that TV and satellite and cable TV have really expanded, particularly in Asia, and that's beginning to happen much more in Africa as well. And we could think about this being part of a body of evidence that might suggest convergence in some types of attitudes as a result of exposure to outside media of this type.